everyone, and welcome back to the Diary of an Endodontist. And today I've got another tricky incisor for you. You know that I love incisors because when you think they are easy, they can be quite tricky. And this is one of them. So the patient had a trauma, fractured some teeth, as you can see. There is a calcified canal on this lateral. The lateral presents with mobility grade 2. And if you check the CBCT, there is radicular and apical radiolucencies on that tooth. And check the occlusion here. Well, of course, on the CBCT is not for us to check the occlusion, but it's important to check the occlusion. And normal occlusion, protrusion, and you can see that there is premature contact on that lateral. The lateral presents with a buccal fistula, and remember the mobility. The mobility is pretty much because of that premature contact. So it's important for you to bear that in mind, because after the treatment, you need to adjust the occlusion. As this patient lost the posterior support, there is a loss of vertical dimension already, so you don't want to grind that tooth. You want to build up the other teeth. That's what it needs to be done, and the dentist is going to rehabilitate this patient and do a full mouth rehab. However, until that happens, it's important that you preserve a little bit of you offer a little bit of stability for that tooth to heal after your treatment. Otherwise, it's going to fail. When I was doing this scouting after the access cavity, remember that tooth was quite calcified, the canal? Well, there was distortion on my file. And it's important for you to see when you are doing scouting, the preparation of your canal, because if there is distortion, you don't want to use that file any longer, because it may have a separation of this file and it will make your life a lot more difficult than you are planning already. It's important to know that you can mix match systems. So I was planning to use the Trunatomy, but I wanted to use a different glider, and the glider I chose was the R Pilot. Can I use the glider from the Trunatomy? Of course I can. It's a wonderful file as well, but it's important for you to know, and I wanted to show you that you can use different systems, combine them. You don't need to use just a simple system and finish with the GP of that system. You can mix them if you want to. So now the Trunatomy, preparing the canal, and choosing the GP. That's the thing. In that case that I chose the Trunatomy, it's better to use the Trunatomy. Why? Because the 2504 I had in my drawer was so thin apically that I wanted to give a bit more pressure for my sealer to flow apically. Remember I said that we are not adjusting the tooth, grinding that tooth down. We need to build it up. Well, there was a fracture on that central with a little bit of granulation tissue, and I need to prepare that and build up with a composite. It doesn't need to be perfect, but what you don't want is to have like lots of gingival inflammation after you build up. So remember the hot tip I used on the previous episode? Well, you can use the hot tip again, and you can remove that granulation tissue so you can build the tooth with composite. It doesn't need to be perfect. You are not there to do the cosmetic, the final work. Don't put pressure on yourself. You just want to give the guidance on occlusion, stabilize the occlusion, give guidance on protrusion, lateral excursions. You want to balance that, because what you don't want is too much pressure on your lateral, because you've just finished the root canal treatment. That tooth was with the mobility grade 2. You want that tooth to heal. And if you have pressure, if you have premature contact, that will delay the healing, may compromise the healing. In occlusion, protrusion, lateral excursions, and balance that so you can protect your treatment. And this is it. It's the final treatment for you. But when you write a letter back to the dentist, make sure you explain how urgent it is to give posterior support to take the pressure away from that tooth, because composite will wear off. So you don't want that to happen and starting compromising your tooth again. So it's important to build up all of those teeth. Go to the provisional area first, provisional step, first, and balance that occlusion. Hope that helps now. It's not a simple case. It's not a daily routine. pain is one of the difficult cases where you have to take the endodontic hat, put the prosthodontic hat, and all of that. But it is important for you to know that you need to do that. Hope to see you on the next episode.